Untamed TV watchers. This is your host, Craig Bielek, and I'm joined today by Lance Bryce, a general surgeon practicing up in Brigham City. And we're going to talk about something that I've always been curious about, and I really don't know much about it. So I'm learning as you're learning today. We're going to talk about the gallbladder.
Great
right?
topic, absolutely.
Is that first off? Is that its term? Does it have some sort of medical term? Is it the
gallbladder,
itchy scratchamole or something like that? It's the gallbladder.
It's the gallbladder.
Okay, what is the gallbladder? I don't even know.
So the gallbladder is essentially a storage bag for bile, and bile is a chemical that's produced in your liver by a certain group of cells. And bile's job in our physiology is to help us absorb fats and cholesterol in our diet. All right. The interesting thing about our bodies, this would be not a known thing, but we have a very difficult time actually absorbing fats and cholesterol across our intestinal boundary.
Really?
It's almost impossible. We actually have to use bile to get around the fat molecule like a Trojan horse and take the fat molecule from our intestinal lining into the bloodstream and let it go.
So the gallbladder is it's a secret agent.
Well,
yeah, I mean, it's a smuggler.
It's a house for the secret agents.
Yeah. It's a smuggler. I didn't even know that. So I assume it's located somewhere near your liver.
So it's attached to the outside of the liver. So if my hand, my fist is the gallbladder and my hand is the liver, they're literally attached like that. So if I pull my hand away from the other hand, that's the attachment. It's a spider web looking material called a areolar tissue that just sticks it to the outside of the liver.
Wow. So it's doing this job. It's helping us absorb the food we eat, basically.
Fats and cholesterol.
Fats and cholesterol.
Mm-hmm.
So is the gallbladder working harder nowadays than it did, say, 100 years ago?
No question. No question it is.
Right.
Yep.
Because we're pulling up to fast food joints and we're frying everything.
You bet. Yeah. Yeah. The greasier the better. Greasy foods taste great. That's why people eat them. I
know.
Yeah.
I hate that.
Yeah. I love it, but you just got to be careful with how much you eat.
Well, and that brings us to our next question. How do you know when something's going wrong with your gallbladder? Because things go wrong. Right.
So gallbladder pain is usually described as right upper quadrant pain that can sometimes go towards the middle of your abdomen. This area is called the epigastric area. And it's usually associated with some form of eating, either within a few minutes or up to a couple of hours later, depending on how fast your stomach's wanting to digest and push the food through. But it's severe pain. The pain can either be isolated to the front, it will track around the outside and go to your back, or it'll be just like a sword, goes straight through from the right upper quadrant right out your back.
Can people mistake it for a heart attack?
I would say that probably 1 out of 10 gallbladders I take out that visit the ER went in there because they thought they were having a heart attack.
Yeah.
So they do 12-lead EKG, cardiac enzymes, they listen, pulse rate's fine, and then they go and get the gallbladder ultrasound and see stones or gallbladder wall thickening, etc.
Okay. And a lot of this can be brought on can come on really sudden after a meal. You go down to your favorite fast food
joint. It can
joint.
happen during your meal.
Yeah.
Yeah.
You get the fries, you get the double cheeseburger,
Mm-hmm.
you throw in the fried shrimp or whatever.
Sure.
You get all that in you, and then all of a sudden, ooh.
And it's painful.
Right.
Yeah.
So gallbladder attacks, they can come and go, or they increase with frequency, both?
So basically, if you have your esophagus, it comes down into your stomach. The stomach churns up the food. There's a little muscle opening at the end of the stomach called the pylorus, and it basically rejects food based off of particle size. When the stomach gets the particles of food down to something we can start to absorb, when the food comes out of the stomach into the small intestine, there's a hormone signal that goes up to the gallbladder that says squeeze. The food's coming through. And so it exits out of the gallbladder down a tube system that comes out right in the second portion of the small intestine. And it's kind of like a car wash. As the food goes by, the bile gets squirted onto the food, gets a chance to mix up, and if there's any fats and cholesterol in that food, it surrounds it and we get to absorb it.
I didn't know that. Like a car wash. That's fascinating to me.
Yeah.
They hang the little tree freshener at the end of it or whatever.
No, that
doesn't happen.
But it's kind of like those side sprayers on the car wash.
Yeah,
That's where it comes out in relation to where the food's going by.
Okay, so you have a couple of gallbladder attacks, and then all of a sudden you have one or two a week, and then all of a sudden almost every day, and pretty soon it's time to take the gallbladder out.
Yep.
Or do something. Are there other treatments or antacids and things like that? Do that work?
Antacids do zero for the gallbladder.
Okay.
Zero. In fact, there's really not a really good pill medication for gallbladder disease.
Okay. All right. So no way to treat it, but you gotta take it out. So here's my big question: is if you can take it out and be fine. I know people that had their gallbladder removed 25 years ago.
Sure.
Why do we need it in the first place? Or do they have to change their diet and all that other stuff?
A very small. This is the unfortunate thing: is a very small number of people actually have to change their diet.
Okay.
The diet's what got them into the problem in the first place, but the body does a really good job compensating for this lack of gallbladder. So, and the reason for that is if the gallbladder's full and it squeezes and empties all of its bile, our body will reabsorb about 95% of that bile, so it gets recirculated through the system. The 5% that we don't reabsorb is what gives our stool its color.
Okay.
But it's very efficient to reabsorb. So patients will ask me that, what happens if I don't have my gallbladder? Well, you go from a big dump from the gallbladder to basically a water faucet, drip, 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 24/7. And there's bile just constantly going into the small intestine. And the body readjusts to that somehow, and
Really?
they do fine. I'd say I've probably done close to 1,600 gallbladders in my career, and there's probably 5 or 6 people. They have this horrible, wonderful life. So the wonderful part of their life is when they walk in a room, everybody admires them because they're perfect. They look like they've been in the gym 5 hours a day, 6-pack abs.
Wow.
But they can't eat anything greasy. They can't go to a birthday party and have a bowl of ice cream because when it hits, and they better be heading to a restroom within 20 minutes. And it's cramping. It's foul smelling. I call it zone defense diarrhea. It just clears the house.
Really?
Yeah.
Wow.
So-
Wow. So keep your gallbladder if you can.
If you can.
That's
So try
that's
and
the
prevent
best
it.
advice.
Try not to even get to the gallbladder operation if you can.
And so preventative things. Watch your greasy foods.
For sure.
Those kind of things. Eat fruit and vegetables. All that kind of stuff. Not
Yep.
fried fruit and vegetables like I
Right.
know you want.
Right.
That kind of stuff. So let's talk about the surgery then.
Okay.
How do you take the gallbladder out?
So we use a laparoscopic technique, which means TV camera, small incision. We can do that if you haven't had a lot of operations on your abdomen before. Lots of operations before kind of set you up for a lot of scar tissue. And where we need to get the angles for our ports and our TV camera may not be possible because the bowel's either stuck up there or scarred. But since 1989, we've been taking them out with a TV camera approach. And we can usually do that about 98, 99% of the time. The old-fashioned operation was a 12 to 18-inch incision here, or a midline incision. And just the recovery from the incision itself was 6 to 8 weeks.
Wow.
Whereas, we do 4 incisions, 1 above the belly button, 2 out here on the right, and then an incision right here. And different surgeons will do different things. There's always one larger than the other 3. I choose to put mine right here because there's a ligament behind that during the surgery I use and pull up to buttress behind that so you don't get a hernia in the future. Others choose to put that big incision right here, but it doesn't really matter. It's four incisions, and we can basically do the same operation we used to do with our hands, but inside the abdomen. And the recovery is only 10 to 14 days, and that recovery simply is
Much better.
no heavy lifting greater than 20 pounds, and showers only for 2 weeks.
Wow.
And we tell people, be careful getting back into your diet.
Easy,
Yeah,
watch
too
the
quickly.
diet and all
Yeah.
of that. So what happens if you ignore it? I mean, what happens if you're always having a gallbladder attack and you're a big tough guy and you're just like, forget it.
You'll come and see me in the emergency room because it will force you to be there. You'll get really sick. Just a couple weeks ago, I took a guy. For 8 months, he kind of fought this back and forth, and his gallbladder actually became necrotic. It literally died on him, and so it was ready to rupture. And when it gets to that point, they get infected, and if that infection gets out, it gets into the whole abdomen. and then we have to work really hard
You're in
to
trouble.
try and save their life. Yeah.
You're in trouble.
Yeah.
All of that.
Yep.
Wow, interesting. See, did you know this about the gallbladder? I didn't know this about the gallbladder. Like I said, I didn't even know what it was or anything like that. All that. Anything you want to add? I mean, did we cover the gallbladder? I would not want to neglect the gallbladder.
Yeah, so there's one other thing people will ask me about gallstones
that's
that can form
right,
in the
you mentioned
gallbladder, and they'll say, can you just go in and take out the stones? Well, we probably technically could, but guess what you're probably going to form in the future? More stones.
Right.
So you either cut the fats and cholesterol out of your diet, be super good with it, or you're going to form stones again. One of the things is that the dangers of having the gallstones is they can actually get out of the gallbladder and block up the tube, the bile duct coming from the liver, which meets up with the pancreas duct. And if you block up the pancreas, now you've blocked up two organ systems, the pancreas and the liver. And gallstone pancreatitis, which is what happens when the gallstone gets stuck at the mouth of the pancreas, it doesn't care. It has very powerful enzymes. Everything that we put through our body gets broken down by either the stomach acid or the enzymes in our pancreas, and it's non-discriminating. It will eat itself. And once you get a bout of pancreatitis, you can get pancreatitis for no reason whatsoever in the future, and that's the danger of it. I've seen 5 people almost die from the gallstone getting stuck at the mouth of the pancreas, and then they just try and ignore their pain and those kind of things, and then they end up in an ICU for 9 months.
And you are in trouble.
Yeah.
Take care of your gallbladder. Watch your fatty foods. I know they taste good. Trust me. I really do. But watch them.
Yep.
Watch your fats. Watch your cholesterol. Those sorts of things. Being on a statin or something like that, does that help with gallbladder issues?
I mean, the idea of the statin is to kind of help you with your genetics, to be able to process and handle the cholesterol. The biggest thing, cholesterol has to be put across your lips. You have to control these. To choose wisely the types of things you're putting through. Statins obviously can help, but if you're just shoving cholesterol and fats in there, I don't see how that's going to help you a whole lot. You got to change behavior.
You got to do it. Unfortunately, you got to do it. Well, we're out for Untamed TV for this episode with Dr. Lance Bryce. If you want more information, check it out. BrighamCityHospital.com. Let's go have a salad.
Let's do it.
Me and you.
Okay.
Salad and a glass of water.
Yeah.
Untamed TV. Untamed.